Hey girls! So it is Annabelle's 4-month update. It is that time already. She is 4 months old. And she's doing really great. I'm feeding her right now, but when she's done, I'll show her to you. But she is just a joy, I guess is the best way to put it. It's hard having two babies, and that's the challenge. Like her by herself, she's fine. But having two, especially a toddler like Connor who gets into everything, and I'm sure like a lot of toddlers are like that, but he's I think he's an extra handful. Like he tries to eat things that aren't food, like charcoal and chalk and things like that. And I talked to his pediatrician about it, and he thinks that Connor has pica. I think so too, because of like my history of anemia and the blood disorders that I have. It's not like completely like unlikely that that's what it would be. Like it probably is pica, but he's at an age we don't really want to supplement him with iron. And he's had his levels checked and everything, and he's anemic. But like I said, that comes with the trait. So he's not like overly anemic for the trait that we carry, which is thalassemia minor. If you haven't been following me too long, we have beta thalassemia minor. Yeah, so he could have pica from that. Anyways, I can't leave him for a second because anything could go into his mouth and he could eat it. And it's not like he does it all the time, but he especially tries to do it when we're not looking. So, and why we think it's pica, like when he ate charcoal, which was like, it was months ago, we were outside and he just, I mean, you don't think a 2-year-old is going to pick up charcoal and try to eat it. Not only did he try to eat it, he thought it was tasty and he asked for more once we took it away. So that's the difference with pica and like a 2-year-old is, and this is what the pediatrician said too, like a lot of 2-year-olds will put things in their mouth just because they don't know any better, because that's the first time they've encountered that. But they're not going to think charcoal is delicious, and Connor does. So, anyways, that's a little off topic, but like getting her down for naps and getting her like into a real routine is a challenge because I can't like leave him and go rock her and put her down in her bed for a nap. So what we've started doing is like I'll take are you done? I'll take Connor up in her room and have him play quietly. I try to get him to play quietly while I feed her and put her down, and it worked today. He played. It only took a couple minutes to put her down because she was really tired, and he played, and that was great. She slept for 2 hours, and Connor and I got a lot of time to play, and I even got the house picked up. I didn't get a shower yet, which is why I look like this, but progress, right? Say hi, Annie. Hi. She really likes to look at herself now, and she's standing on my lap. Obviously, it's reported, but she loves to be on her feet. So that's the biggest challenge with Annabelle is balancing her needs with Connor's, because, like I said, I cannot leave him for a second. So he's got to come with me everywhere. And he, like, if I get her to sleep in our playroom, because we have a pack and play there, like, without fail, as soon as she falls asleep, he like will drop something or bang on the piano or do something, and she's awake. So she gets overly tired, and that makes it hard. So if any of you guys, yeah, oh, please don't spit it up. If any of you guys have suggestions about ideas of how to get her on a schedule while keeping him happy, he does take a nap every day still, so I have that time to work with her, but it's usually not when she's tired. She gets tired before he does. So that's that. Breastfeeding is going really well. She's still exclusively breastfed. She's never had formula. She doesn't take a bottle, and I am back to work, which presents a challenge that we've been dealing with every weekend. So one weekend she took the bottle fine. Another weekend she took it a little bit. Another weekend the past 2 weekends, Mike had to feed her with a dropper because she refused the bottle. and she only took like 2 ounces, and then she threw up, he said, like more than she ever has, because she was so upset. She was crying, and she threw up everything she got down. So we might have come up with a solution here in the past week. We decided bottles aren't working, dropper feeding is frustrating for her, so we just started her on a cup. And I don't have the cup down here with me, but I'll insert a picture of it, and I'll try to get a picture of her eating out of it, but it's really hard to get that in a picture because it takes a lot of hands to cup feed her. But we just take the cup, it's just a flat rim cup, we hold it up to her lips, and we have her sitting up when she's doing it, and we just put the milk parallel with her mouth, and she kind of licks it out and drinks it that way. And she actually, the first night I tried that with her because we were just getting desperate, and I don't want Mike to have to try to do that while I'm gone for the first time. Like, so we've been practicing at bedtime because that's when she'll get that feed when I'm gone. She took 4 ounces the first time we tried the cup, and she just lapped it up, and she slept for 8 hours that night because she got a good feeding in before bedtime. And yeah, so she did really good with the cup. It's messy. If you want to try it with your baby, I suggest swaddling them the first time or two, so they kind of then know what to expect, because they don't know exactly how to use the cup at first, and they'll knock it out of your hand. Oh, and I don't know about you, but I don't like wasting breast milk by spilling it. So yeah, we swaddled the first couple times, and now she actually will hold the cup and try to help. So now we let her do that. But yeah, she's on a cup, and you know, she nurses 99% of the time, but those 1 or 2 feedings she has to have while I'm at work are in a cup. Well, I haven't been back to work yet with the cup, but we're hoping it works, because if not, we're really gonna have to start figuring out what to do about work. And I did try the Medela Calma. I'll put a picture of that in too. It has like 5 years of research behind it. It's supposed to, babies are supposed to be able to feed on it just like the breast. And just for anyone who's interested about that bottle, I think it would work if it was started early enough. But she just chewed on it, and when she did bite down, some milk would go into her mouth, but it wasn't, you know, enough to fill her up. So I guess we still have it, and we'll use that if she won't take anything else, because a little bit is better than none. But I think for now we're going to try to stick with the cup. So she's smiling and talking, and she loves sitting on her feet. We started the exerciser here lately, like within the past week, and she likes it. She plays with everything and spins around, and yeah, so that's fun. Sleeping wise, she's sleeping. We put her down she's normally in bed asleep between 8:30 and 9. Without fail, she wakes up at 11, between 11:30 and 12 every night. And I think when she goes down, nursing is just such a comfort. She doesn't actually eat. She just like kind of comforts herself to sleep, and then she wakes up hungry 2 hours later, and I feed her, which I'm still up, so that doesn't bother me. And then after that, she normally eats around between 3 and 4, and then again at 7, and that's a typical good night. But we have nights where she's up much more frequently than that. So, and Connor, last night he was up twice. He's been having nightmares, so when she starts sleeping, he's waking up now. So, but I smile because I know I've been through it all before. Like, everything's a phase, and they outgrow things, and things get better. So this is just what we're dealing with now. So even though she only got up twice, I was up 5 times last night. So napping, like I said, we're working on it, but it's not regular at all. A lot of the time she'll fall asleep with me holding her or in a carrier. The carriers we're liking right now. She does fit in the ergo finally without the insert, which she hated the insert, so we didn't use the ergo until she fit in it without it. I also have a rebozo. It's a piece of cloth, woven cloth. It's used like in labor support and prenatally, to kind of lift the belly up, and you can do like exercises and help the baby get into better positions and things like that. So I got a really long rebozo, hoping that before I am a doula, I can use it as a carrier, and it really does work. It's like it's kind of like a Moby, but you tie it differently because it's not stretchy. And she really likes it, and I like it because she's not like in a Moby or a sleepy wrap. They kind of start sagging after a while, and you have to tie it back up. But with a woven wrap, you get a good snug tie. She likes it. So diapers, she's in Dinkle-Doos, Fuzzy Bun one size. We have a Fuzzy Bun small that she fits into, a Grovia all-in-one, one size, and Bum Genius 4.0. So those are the diapers she's in, and they fit her, and we like them. And a suggestion I have, if you have two in cloth like I do, I put one like a Dinkle-Doos or a Bum Genius are the ones I take with me. I don't take Fuzzy Buns in the diaper bag. And then I just put like a larger insert so it would fit Connor if I unsnapped it, or if I needed to, I could fold the insert and put it on her. It would be big, but at least I'm not having to bring diapers for both of them. I can quickly just change the snaps and have it fit either of them. So that's been working well for us when we're out. She's teething. I don't know if you can see, but she's chomping on my hand right now. And the last thing, my list is over here. The last thing is, I think she's getting ready for solids, but I'm going to try to hold off on solids. I wanted to until 6 months because she was showing no interest in solids at all. And this past week, she's been like, when she sees us eat, she like whines and like a puppy, like for food. Like she is like really interested and really wants our food. So what I've been doing to pacify her while we're eating, because she's at the table every night with us, I've been giving her cup that she drinks milk out of now, and I put like half an ounce in there and let her make a mess and feed herself. It's breast milk, so it's she thinks she's having something special, but really she's just having more milk. With Connor, when he was in that transition phase where he was on cereal for a long time because his reflux, like from 8 weeks on. As far as other solids, we started them all later. But before we started solids with him, besides cereal, I would freeze breast milk and kind of make it slushy and feed that with a spoon to him. And I also would feed that or freeze breast milk in ice cube trays and put them in a mesh feeder and let him chew on it. So it was getting him used to different temperatures, because when you feed breast milk's warm, so it was cold, and different textures, like a slush, and then the frozen is hard. So we got practice kind of eating breast milk in different ways, and I plan on doing that with her when her little cup is no longer doing the trick, because I really want to wait till 6 months. I have read though that if you wait till after 6 months to start solids, that there's an increased risk for celiac, or however you say that, disease. And so, right around 6 months is my plan on when I want to start. And we're going to start with oats, I think, and not rice. So, yeah, but that's what's going on. Here's Annie. She is just about 14 pounds. She's 13 pounds, 14 ounces as of yesterday at our breastfeeding group, right? We go to support group every week, and it's been wonderful. We've met all these women who are like-minded, natural mamas, and we have a meeting once a week, and then about every 2 weeks we get together for a play group as well with the women there. So Annabelle has a bunch of boyfriends because all the babies in group are boys. They're all boys, Annie. You have lots of boys to choose from, right? And they all think you're so cute. She's not dressed all girly now because I don't have any short sleeve onesies, and it's like 82 degrees here today. So we haven't bought summer clothes yet. We thought we'd have spring for a little while, but no, we jumped right into summer. So this was one of Connor's onesies, but it's not too boyish, right? And you can see her little amber teething necklace there. We got it on Etsy. So that helps a little bit with teething pain. She's not terribly fussy or anything. So yeah, but that's what's going on, right, Annie? If you guys have any questions, let me know. I am probably going to do a separate video on this, but I have decided to start my doula training in May. So I will be starting that training, and then I'm not planning on actually like being a doula until she's like a year older. So just because finding childcare is going to be easier when she's older, and I don't really want to leave her. She can come to training with me, and I can pump while I'm there. So she's going to probably come like half days with me, and my husband will come pick her up, and then I'll pump the rest of the time. Yeah, that would be super fun. We have the baby there. We have a baby. Right, Annie? Can you give him a smile? Can you give him a smile? She's ticklish. She's ticklish. Are you ticklish? Are you ticklish? Tickle, tickle, tickle. Tickle, tickle, tickle. Tickle, tickle, tickle. Tickle, tickle, tickle. Tickle, 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 tickle. Yeah. That's so funny, Mommy. That's so funny, Mommy. Alright, girls. Thanks for watching. Say bye.